Good morning, everyone. My name is Scott Pope. I'm the CEO of PharmD. It's very exciting to be at the very beginning of your Friday mornings today. I really enjoyed being part of the sessions yesterday, and there was a bit of a recurring theme that came around that was kind of bookended the day a little bit too. And it's this concept that we're going to talk about around relationships. Marty mentioned it in his opening session, his keynote, this concept of relationship-based clinics. And then Z-Dog in his tear-up with Marty at the end of yesterday, that was, I think, more entertaining than it was educational, but it was remarkable on both fronts. He mentioned the idea of relationship medicine. And in fact, that's what we're going to talk about in this session today. I'm fortunate to have two physicians with me, Dr. Carlos Jorge with Companion Health and Dr. Joel Bessmer with Strada Healthcare. Each at different ends of their journey in DPC. Carlos is relatively new. Dr. Bessmer has been about 10 to 15 years in his membership-based medicine journey. And we want to talk about really relationships as the future of this notion of membership-based medicine. And I think these relationships come in two different forms. One on that physician-to-patient relationship that I think is very different in this model of care, but also the one that is between physician and physician, as we've seen a lot throughout the course of yesterday's programming. So with that, I'm going to get out of the way and turn it over to Dr. Jorge to talk a little bit about the importance of relationships in membership-based medicine. Carlos?
Yep. Thank you, Scott. And thank you to Hint for hosting this. It's been great, and we appreciate it. So as Scott mentioned, I am sort of at a initial part of my journey into membership-based medicine and DPC, and Joel at the opposite end, I would say. I have been in healthcare for 20 years. I like to say I did time in very traditional systems, insurance-based models, and just more and more saw the writing on the wall that this was a non-sustainable model. And frankly, at the point that I reached, was ready to get out of medicine. And so, after a lot of soul searching and really thinking about what I wanted to have for my future in medicine, the membership-based model just made more sense. So we plunged, ahead in the last year in forming what we were, creating a new clinic. And I do direct primary care, but also am functional medicine trained. So our programs are membership-based. Functional primary care is how I like to say. And so for me, relationships, both with, for example, Hint, but with other providers, has been real crucial. And one of the things that I recognized very early on is that there was a lot of information, a lot of sort of steps that I needed to take that without having a good group of supporting physicians and other folks that just had already gone through that startup phase, I was going to be fairly lost. And so for me, in our sort of market, PharmD has been a real great resource. And, I've also got the distinction of being one of these new clinics that has started in the midst of COVID. So, it's been an entirely just different feel, different challenge. But, one example I can give that's been great, for PharmD at the very beginning, in April, we were already having just conversations with groups of physicians, talking best practices, trying to figure out this whole, direction of what was happening in the COVID, just system that we were now operating under. So that has been a great relationship to have, just to be able to bounce ideas off, and if I, to reach out to other folks who have been through it. From a client and patient standpoint, for me, it's just really rekindled what I love about medicine, which is, most of the time our average visits are initial visits for when they come into our practice, 60 to 90 minutes. And, we're spending just deep dives trying to understand what causes people to get sick. And that's a relationship that, for the last 8 years of my insurance-based clinical practice, I think I can count on one hand the times I spent more than 15 minutes with somebody. And so, I think for me, that love of medicine and that sort of transmission of why I love medicine is now being seen in the clients that we serve. And the clients love it. I mean, our patients they walk out and they go, wow, that was just totally unlike anything I've ever experienced. So For me, as I sit and I see all these people who are involved in direct primary care and membership-based programs, this is the future. It has to be. We have to get back to why we love medicine and the relationship between providers, physicians, but the relationship we actually want to create with our clients and patients has been the key driver for me. So I'll stop there, and then we'll give some time to Joel and then questions. So thank you.
So Carlos, that's powerful, and I'm exactly the same way. I want to take the conversation another direction, though. So Carlos is talking about his relationships with his patients, and that is what drives all of us, I think, into membership-based medicine. And I love the idea. So I'm the guy on LinkedIn, right, that I think Marty was talking about, who referred to him as a disruptor. And it struck me yesterday in his talk when he talked about, I don't see myself as a disruptor. I see myself as a restorer of medicine. And that's powerful. And what I want to talk about is not so much that patient-physician relationship, but the physician-physician relationship. One of the things we've got to be able to do in membership medicine is come together as groups and work together for the betterment of our patients and also for the betterment of our healthcare system in the United States. And ROAMD is trying to lead that. We have a PAC put together, a physician advisory council that is just unbelievable. I mean, the PAC in and of itself has on average about 15 years of experience amongst each of the individuals in delivering membership-based medicine. You've got Jordan Lipton in Charlotte, North Carolina, and then you got Jordan Schlain in San Francisco and New York. Imagine trying to run your practice in two big cities. But if you don't know Jordan Schlain, let me tell you, that guy can do it, and he's doing it and doing it well. And there's so much to learn from him about that. You got Radley Griffin in Tampa, you got James Pinkney in Dallas, you got Matt Pretty in Indianapolis, and you got Carrie Dawson in Denver, and myself. And so that PAC is really here as a resource for you. And what we're trying to do is help ROAMD create a membership model for us as physicians to be able to come and learn from each other and help each other. And then also that important part of patient care delivery, right? So I got a patient in Charlotte who's sick, and I just need to know, where can I get a chest x-ray? Where can I find a lab to get stuff drawn? It may not even be that I want another physician to see my patient, but if I can find an easier way to make healthcare deliverable to that patient in that location, that's what ROAMD can do for me. That is one of those things it does for me. But what I love about ROAMD the most is how it feeds my soul as a physician in physician-to-physician relationships. And that is what it's all about for me from that standpoint. Utilizing the physician network is a beautiful thing, and you'll find it easy to do with us. We're getting ready for our annual meeting coming up here, and one of the things I'm most impressed about is we're going to have a virtual meeting also. But the PAC is all flying into Charlotte so we can be together, so we can present the meeting together and feed off of each other, because we know that how important that is for us. And it's not that we can't feed off of each other here in a video call, but it's so much easier when your personalities are together in the room. And when we come together as personalities, it gets a little bit dangerous. I hope you're able to join us.
Excellent. Thank you, Joel. Thank you, Carlos. I think one of the themes that resonated yesterday and I think comes across today is just that abundance mentality in the spirit of the membership-based physician is one of abundance. And it's not one of trying to keep people out of your market or try to keep people down, or it's really about raising them up. And that true spirit, I think, is much of what I see embodied in the ROAMD membership in those physicians that I feel privileged to get to work with. Carlos, you want to talk a little bit about some of the insights that you've gleaned from a relationship perspective, and whether it's specific around COVID or other things that you're looking at for the business side of your practice getting out of the gate.
And it's and I agree with Joel. It'd be we love being in person, and this is a setting that we're all adapting to. But specifically, I would say with COVID and us starting, we had obviously the delays in construction, all those things, but it was just so reassuring and reaffirming that as I was starting something from scratch after having done traditional practice for 17, almost 18 years, I had an immediate sort of group that I could say, I've got questions about, where do I get PPEs? Who are the best suppliers for these things? let's talk about the medications. Do we need supplies for these? So there was an immediate, I would say, sort of safety net of comfort that I could, at the end of the call, hang up and just kind of talk to my CEO, who's my wife also, but she is our CEO, and just be able to say, look, these are the things that folks are implementing in other places. Here are the contacts that we already have. So there's just an immense value to that. That I think what I've also found in the DPC world and membership world is that people are really open, and you ask questions of other providers. There's not this, hey, no, that's my little secret, I'm not going to tell you. I've found it to be quite just refreshing to see. If you want the forms that I use for this, I'll get them faxed over to you. And in the I do a functional medicine as a board certified functional medicine doc too. It's very much membership based on most of the practices that exist in that world, and I've found it to be the same way. It's a very open community. We all have the same goal, which is how do we improve the lives of the folks that we're taking care of, and how do we improve healthcare and medicine overall to really sort of change the outcomes for all of us. And so for me, it's been super, super, super helpful. I just can't think of doing these types of programs alone. And I just don't think, even with COVID, the setbacks, we would be where we are today without having that foundation of support.
Yeah, I mean, and once again, Carlos, I mean, those of us that have been doing it for a while made a lot of mistakes in the beginning and cost ourselves a lot of money and spent a lot of money to do a number of things that can help save some of the startups money. But also, Scott and I were talking before we went live, right? Somebody's been doing this for 3 years. My comment to him was, I hadn't made half the mistakes I've made in the first 3 years. So there's still a lot to learn. There's still a lot we can help with, even if you've been an established practice. And I think especially from a standpoint of the physician-to-physician networking.
Yeah. Well, and Carlos mentioned the word, one of the things that we like to hang our hat on is that we want these practices to remain independent, but independent is not alone, right?
I love it.
Carlos mentioned alone, and that, doing this together, that was when I was asked to stand up those COVID webinars, and we did them every Monday night at 8 o'clock Eastern for an hour. And we had, upwards of 40, 45 physicians that joined. As much as, Carlos mentioned, there was a lot of answers exchanged. I really felt it was as much therapy for the physicians to get to look each other in the eye and say, I don't know, right? We don't have answers to some of these, and I feel bad not having the answer. I feel a little bit better when I see 15, 20 other people who also don't know the answer. And it's not that I don't know it, it's that there isn't an answer for this, and that's okay. And we try to work towards getting more answers, shoring that up, working in the confines of what we do know. But again, it's about having that relationship with those physicians who are in the same boat.
Well, Scott, and the true evidence of that was what we did with COVID. For those of you who aren't aware or weren't a part of it, every Monday night, Rome had a phone conversation where all you did was you logged in on Zoom, and we just discussed, hey, what's going on in your community with COVID? How are you dealing with this? What can we do to help you? There was a number of people getting on, where can I find PPE? I can't get this equipment. And the whole point was, we as a physician group nationally came together and networked with each other to help improve the care in the entire United States. That's what this should be about. Well, thanks everybody for joining us. This is, it's awesome. I don't know, Scott, did you want to try and take any questions? Do you want to try and deal with these after? What were your plans for questions?
Yeah, I'm happy to take questions. If Lauren wants to come in and moderate any Q&A for us.
Program.
Scott, I just have one quick question for you. Can you hear me? Yeah, cool. If you're a Hint customer, how do you get roamed? What do you need? What do you do?
Yeah, absolutely. So we solidified the relationship with Hint, and actually in the Hint platform, if you go to integrations, there's a button where you can do your integration with Roamed directly inside of the Hint platform. If you have any questions, you can also go to the Expo, and there's a button there in the Expo that you can join Roamed directly from here as well.
Awesome.
Amazing. I think you guys nailed it on the head. Community is the new currency, and clearly you're bringing the right players to the table to be able to support each other in the expansion of the DPC blueprint. And so thank you so much for your time today. And for those of you who want to continue the journey, head over to the Lean Startup with a Cube. But thank you guys.